Diabetes has exploded 700% in the last 50 years, and it is estimated by 2030, which is right around the corner, is going to be half of all medical claims. Right now in America, every minute somebody has an amputation, and every 30 seconds someone's dying from complications. That doesn't have to happen if we get a better handle on how to manage it.
Kay ran through this presentation with me, I don't know, probably 3 weeks ago or something, and it was shocking. I thought maybe I'm the only person in America that didn't know these things, but I didn't know these things, and it was really eye-opening and amazing to think about the impact of diabetes on a company's healthcare costs and what kind of changes, simple changes people can make to have a huge impact. And I told her if I'd have known that in my old role with 1,000 people, we would have been all over this. It was just something I had never heard or seen presented this way. And so it was really fascinating. And so I thought it's something that maybe nobody else has heard like me. So maybe it's a chance for us to learn something and ask questions and think about how we can continue to have a big impact on our businesses, just of helping manage health and the businesses that we know around the community. So I will turn it over to Kay and let her tell you a little bit about what she's doing and tell us about these little changes we can make that can have a big impact.
Well, hi everybody. As you know, my name is Kay Pfeiffer. I live in Nashville, Tennessee, a little bit south of the city. I've been a health educator for the last 40 years. And for the last 3 years, I've been working for a diabetes care company. And I think Randy's not alone. The majority of people in America have no understanding, unless you have diabetes in your family. They have no understanding of how severe this issue is. So hopefully this presentation will help all of you have a better understanding of diabetes. I'm going to share my screen now, but I'm going to be looking this way, so hopefully that's not a problem. If anybody has any questions, there's a chat box open. Send me a question during the presentation. Otherwise, I'll try to be done in 40 minutes, so we have lots of time for Q&A. And I'll also provide you with my email address and my cell phone number if you have any questions afterwards. And like Randy, if you have any other groups that you're part of or you think this information would be helpful to somebody else, please just contact me and I'd be happy to share that with you. So what are we going to talk about today? As the screen says, we're going to talk about what is type 1 and what is type 2. There's still a lot of confusion out there about what the difference is. What are the incidences of diabetes? What states have the highest incidence of diabetes? And what the related cost is, and some opportunities for all of you to have a better understanding of the disease so that we can impact the cost. Diabetes has exploded 700% in the last 50 years, and it is estimated by 2030, which is right around the corner, is going to be half of all medical claims. Right now in America, every minute somebody has an amputation, and every 30 seconds someone's dying from complications. That doesn't have to happen if we get a better handle on how to manage it. The history of diabetes, I thought we should start there so you get an understanding of where it came from. And if anybody wants a copy of this presentation, just let me know and I'll be happy to share it with you. As you see on the slide, in 250 BC, people were noticing that people were just passing through urine a lot. They couldn't figure out what it was from, but it was called pass-through. And it wasn't until 1675 where the word mellitus came about. The official name of diabetes is diabetes mellitus. And it came from the sweet taste of urine. Initially, doctors noticed that ants were running to urine and drinking the urine. And then doctors, thank goodness we've advanced from this, doctors were tasting the urine and they realized it was really sweet. And from that's where the name came, diabetes mellitus. So according to the World Health Organization and to the ADA, it's a chronic disease. If someone chooses not to manage their diabetes, it's going to manage them. You're going to have problems with your ears, with your eyes, with your nerves, with your heart. 80% of people who have diabetes also have hypertension, blood vessels, kidneys. It's a very, very, very serious disease. But it could be managed, and we'll talk about how to manage it. As you see in this timeline, we're really in the infancy of the treatment. It was about 100 years ago that insulin was discovered. Insulin is the treatment for people who have type 1 diabetes, and we're going to talk about the difference between the two. But it wasn't until about 60 years ago that there was a differentiation between type 1 and type 2 diabetes. And in 1990 was the first external pump. And we'll talk about why you use a pump and who uses the pump. There is no cure for either disease, type 1 or type 2. There are treatments. You can put type 2 in remission, and we'll talk about that. But for people who have type 1, there's no cure, and no one knows what causes either disease. There's some risk factors, and we'll talk about that too. When I started at this company 3 years ago, 30 million people had diabetes. As of now, 34.2 million people in America have diabetes. That's about 1 in every 10. And shockingly, 1 in every 5 have it and they don't even know that they have it. And remember, as I said before, by 2030, it's supposed to be half of all medical claims. So if you're an employer and you want to talk about how to manage those claims, just let me know. I can help you with that. So who gets it? Anybody can get type 1 and anybody can get type 2. Yes, these people on the screen have the money to manage their disease, but they're also motivated to manage it, right? They know if they don't manage their disease, they can't continue to sing as they do, or to play sports, or to be actors. Tom Hanks was pretty lucky when he got the coronavirus, because people who have the coronavirus and diabetes, they have much, much more serious complications. This is a shocking statistic, okay? 20 years ago, people who were diagnosed with diabetes were over the age of 65. So what does that mean for an employer? Maybe they're 65, maybe they're 70, maybe they're 75, so they're probably not in the workforce as long. Now, people who are being diagnosed are under 65. So 35, 40, 45, what does that mean for the employer? We're going to talk about how much it costs to employ people who have diabetes. People are under 65. What does that mean? We are an unhealthy nation, as we all know. Okay, now we're going to talk about type 1 and type 2. And if anybody has any questions, just stop me and I'll be happy to explain them. 34 million people in America have diabetes, okay? 5% have type 1. Type 1 used to be known as juvenile diabetes. It's not known as juvenile diabetes anymore because anybody can get it at any age. What is type 1? Type 1 means your body does not produce insulin. If you don't produce insulin, you can't break down the sugar. Okay? People who have type 1 have to wear an insulin pump, or they have to shoot themselves with insulin every day. They also have to test sometimes 8 to 20 times a day. I have a friend whose 17-year-old was diagnosed with type 1 at 18 months. They had to wake up every 3 hours and prick his finger to test his sugar levels. You have to test your sugar levels, because if you don't know how much insulin to give yourself. Type 2, 95% of those 30 million people have type 2 diabetes. Type 2 diabetes is a lifestyle disease. Your body doesn't break down the insulin and the sugar as well as it is with somebody who doesn't have it. Your sugar levels are higher, should be around about 100. People with type 2 can be anywhere between 150 up to 600, but if they're at 600, they'll probably be in the hospital because they'll go into a diabetic coma. If you change your lifestyle, you can put type 2 diabetes in remission. No one knows what causes it, but it is manageable. I also thought I should mention prediabetes, because there's a lot of buzz in the industry about what is prediabetes. So as you see on the screen, you can be at risk for prediabetes, which means your sugar levels are a little bit higher than normal. You should be around 100, so maybe they're 125 or higher. And if I'm ever in Kansas City and you want me to test your sugar levels, I'm more than happy to come by and do it. It's really easy. You just prick your finger, put it on a little piece of paper in a machine. It's pretty simple to do. And if you're concerned about yours, just ask your doctor next time and they'll test you. So who's at risk for prediabetes? As it says here, over 45, not active more than 3 days a week, family history of diabetes, high blood pressure. If a woman has gestational diabetes, that's diabetes when they're pregnant, they're at higher risk for getting diabetes later in life. And if you're overweight, it greatly increases your risk of having diabetes. Also on the bottom, Africans, Americans, Latino, and American Indians have a much greater chance of having diabetes. The odds are against you if you have diabetes. It's very hard to manage, but it is manageable. Probability is you will have problems with your eyes, you will have problems with glaucoma, with a heart attack, heart failure, high blood pressure. 80% of people who have diabetes also have issues with their blood pressure. Kidney disease, dry mouth, swelling of the gums, bleeding of the gums. Okay, this is what happens if you have diabetes and you're not managing your diabetes. On the left, you see retinopathy, so that means your vision's a little bit blurry. We deal with a lot of trucking companies, and I have truckers calling me all the time, says, Kay, I can't see so well. Because sometimes this one guy calls at least once a month, he says, Kay, I can't see so well. My vision's blurry, my hands are tingly, my toes are numb. I said, well, what do you do? And he said, well, I keep convincing him to get in our program. He said, well, I just go to 7-Eleven and drink a Coke and get back on the road. Nobody wants an employee or a friend or a family member to be looking at life through these lenses. But this is retinopathy. If you don't manage your diabetes, type 1 or type 2, this is what'll happen. Okay, you're not gonna like these pictures, but this is reality. So hopefully you've all had breakfast and nobody's eating breakfast right now. If you're not managing your diabetes and you get a sore on your foot, okay, this is what happens initially. This is what it looks like, okay? When you don't take care of the sore on the foot, you know what happens? It develops into an ulcer, okay? Does anybody have any idea what happens if you don't manage your ulcer? Okay, I know you're so excited to see the next picture. This is reality, okay? You get gangrene, okay? When you get to this point, and remember, every minute somewhere in the United States, somebody has an amputation. An amputation happens because your foot is so infected. You have no choice. An amputation is $135,000 a year, and a prosthetic's $140,000 a year. It's about $35 a month to get testing supplies. These are some of the signs and symptoms if you have too much sugar or too little sugar. I have a lot of HR people tell me that they love this slide. And again, if any of you want this presentation, I'm happy to send it to Randy to forward to all of you. Because sometimes it's helpful if you notice an employee or a family member or friend looking really pale or sweaty or sleepy, hungry, having to go to the bathroom a lot, blurred vision. I have a friend whose son kept running to the bathroom and was really hungry. And finally somebody said, well, why don't you get tested for diabetes? And sure enough, they had type 1 diabetes. So what does all of this mean for the employer? Okay. First, I thought we'd look at, you're out of this, you're not in the high risk category. The South, the Southern living, all that sweet tea and all of that cooking, the South has the highest incidence of diabetes. West Virginia, Tennessee, Mississippi, Alabama, Louisiana. About 10% of blue-collar workers across the United States have diabetes. About 15 to 17% of the trucking industry has diabetes, and 20% of American Indians have diabetes. In the white-collar world, it's about 7 to 9% of the population. But this is the highest concentration right here. Welcome to the South and all the sweet tea. These statistics are, I think, amazing. As I mentioned before, 10% of the population has diabetes, but how does that affect employers? It costs about 4 times as much to employ someone who has diabetes than someone who doesn't have diabetes. The average in America for medical claims for people without diabetes is about $4,000, and for people with diabetes is about $16,000. And that $16,000 comes from unplanned ER visits, unplanned inpatient days, and pharmacy spend. And we're going to talk in a minute about pharmacy spend and what the farm companies are doing to try to sell their drugs. Now, this is an example of some of the clients we work with. And if you want me to do this for your company, I'm more than happy to do it. It won't cost anything. So the first example for this company, they have 1627 people on their health plan. They have an incident of 16% have diabetes. That's 266. Their total medical spend is over $11 million. But their medical spend for diabetes is over $3 million, $3.5 million. So 31% of the spend is for people that have diabetes. We can help you reduce that number without adding any new cost. For the second example, 14% of the population has diabetes. They're spending over $1 million. The third example, almost $3 million this organization is paying for people who have diabetes, and that's for people who aren't managing it or going to the hospital. Before the coronavirus, I worked at a hospital here in Nashville in the emergency room. We'd have somebody come in at least once or twice a week and say, well, I didn't have time to test my sugar levels. It literally takes less than a minute to test your sugar levels. You could tell by how pale they were and sweaty that their sugar levels were really high. The average length of stay when someone comes into an emergency room because their sugar levels are out of whack, and most of the time they're 300 to 500, which they're about to go into a diabetic coma, is 5 to 6 days. Does anybody have any idea how much that costs? 5 to 6 days in hospital. Let's look at the last example. About 3,000 employees, 14% have diabetes, over $4 million. And what we do is look at the claims year after year, and we'll show you if a company chooses not to do anything, those claims are going to continue to escalate throughout the year as years go on.
Hey, Kay.
Yes, sir.
Those numbers, are those inclusive of the insurance company's cost, or is there a difference between companies that are self-funded, versus what's going through the carriers?
Yeah, we only deal with self-funded companies. So
Okay,
this is all through self-funded.
Okay.
We only deal with self-funded companies because the companies that aren't self-funded won't share their data with us.
Okay.
Their claims data, and we get claims data from all of the big providers. This is also really important. 15 days a year, people who have diabetes have something called presenteeism. Their bodies are a little bit off. Maybe their vision's a little blurry. Maybe their hands are a little bit shaky. Maybe they feel a little bit unstable. Well, if you're an employer, look at your workers' comp claims, because about 70% of people who have diabetes also have workers' comp claims because their bodies are a little bit off sometimes. This is another reason why you need to offer some kind of diabetes care program. So what's the difference between treatment versus management? This is what happens right now in America. You go to a doctor, the doctor says, Randy, your sugar levels are high. You need to manage your sugar levels. Here's a booklet you need to read. Read this booklet, come back in 3 months, and make sure your sugar levels are low. Well, what happens? You walk out the door, and you're like, oh my God, what am I gonna do? I have to go back to work, I have to pick up my kids, I have to do homework. 3 months later, Randy walks back into the doctor's office, and the doctor says, Randy, your sugar levels are so high. Well, that's where we come in. We help bridge the connection between the clinical and what you do outside of the doctor's office. We start with, we'll analyze pharmacy data. We'll analyze your claim data for free, completely for free. As I mentioned, we get data from the Blues, the Aetnas, the Cignas. It's de-identified claims data. And we'll show you how many employees you have on the health plan and what percentage of people, what percentage have diabetes and what the spend is for those folks. We will also show you, which none of the carriers will do this for you right now. We will also show you, out of those employees, how many are testing their sugar levels. Remember, the most effective way to manage type 1 or type 2 diabetes is you have to know how much sugar is in your body. If you're on insulin, this company has 106 people on insulin. Insulin's about $20,000 a year. That means they're shooting themselves with insulin, but only 38 people have any idea what their sugar levels are. That means they're just randomly shooting themselves with insulin without understanding how much to give themselves. That's a dangerous game to play. You have 400 people that are on medication and only 61 people are testing their sugar levels. I have a truck driver say to me, Kay, I can take metformin all day, it's free, and I can pop pills all day. Why would I waste my time testing your sugar levels? Well, if you're popping pills all day, or you're shooting yourself with insulin all day, and you don't know how much sugar is in your body, that really doesn't make any sense, and it's continuing to wreak havoc on your body. We also, when we analyze your data, we'll break down the age range of the people who have diabetes. Pretty typical in America. The older the population is, the higher risk they have of having diabetes. We will also show you, and I'll spend just a minute on this, so if you have any questions about it, you can ask me now or later. The information on the left is for a self-funded group. And this is how much the CVS's, the Walgreens, the Caremarks, they're called PBMs, how much they're charging. A typical PBM, let's just look at the first one, a typical Walgreens, an employee went in on April 4th and he got a 90-day supply. He paid a copay of $35. Walgreens or CVS, one of those, charged $247 for testing supplies, okay? They mark up testing supplies because that's the business they're in. So a total of $282. We provide the testing supplies at what they really cost, which is $71. And we can provide 3 months of unlimited coaching at $165, and it's less money. The pharmaceutical world and the PBMs of the world, the Walgreens and the CVS's, their business model isn't to necessarily make it affordable for people to manage their diabetes. Their business model is to make money on supplies. You see even on the second one, the $276 Walgreens or one of those charged an employer for supplies, and those really only cost $70. So if you think you're getting a good deal from your PBM, call me and we'll talk about it, because even with rebates, they still mark up the supplies. Diabetes. We are a pill popping country. You all know that. The pharmaceutical companies last year spent $450 million, and they'll spend more this year, convincing everybody, if you have diabetes, you can just pop a pill, right? But as you all know now, diabetes is a lifestyle disease. Sometimes people have to take pills to lower their sugar level, but popping a pill for diabetes is like putting a Band-Aid on. It's not changing your behavior. Medication for diabetes is very expensive. Next time you hear a commercial or you see something on TV or on the radio, listen to it for a second. See if you hear along with diet and exercise. Most people do not know that this medication, which could cost $10,000 a year, $6,000 a year, this medication alone is not the answer to diabetes, because it says along with diet and exercise. Okay, so if you're taking a pill and you're not changing your diet and you're not changing exercise, what happens? You're spending a lot of money on medication and you're not helping manage the diabetes. How do you test your sugar levels? It's very, 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 very easy. If you test on the side of your finger, it hurts less. All you have to do is just test your finger, stick a little needle alongside in your finger, get a little drop of blood, put it on a little piece of paper, put it in a little machine, and within about a minute, you get a result. When you know, as I said before, you should be around 100. If you're 150, 160, much lower, you either have to eat or you have to adjust your eating habits or your exercise. This right now in America is the only way to manage type 2 diabetes. And type 1, people who have to give themselves insulin, they will die if they don't take care of if they don't manage their diabetes, so they have to test their sugar levels. Some people wear a patch, and the patch is so they don't have to prick their finger. Because for type 1 diabetes, you might have to test 10 to 15 times a day, and it's much easier, it's more expensive, but it's much easier to have a patch and you can just swap your phone over your patch, which automatically reads the number. So what is the most effective way to manage diabetes for type 2 diabetes? Okay. Testing your sugar level, getting a coach. I always use the analogy, our program is like getting an angel on your shoulder to help you in the journey of life. We all need an angel because life's just challenging for all different kinds of diseases. Getting a coach, somebody to support you, checking your blood pressure regularly, coming up with a meal plan, and walking, right? You don't have to go join an expensive gym. I don't even know if gyms are open these days. You don't have to join an expensive gym, but going for a walk every day. So the combination of support, of education, of testing, of management from a perspective of kind of creating your meal plan for a week. Because remember, you cannot solve a lifestyle disease by popping pills. The only way you can solve a lifestyle disease is by what? Changing your lifestyle. This is a picture on the right. I thought you could all relate to this because you've all had kids or we've all been kids, right? The picture on the right is what happens when you don't manage diabetes. Everything is chaotic. The picture on the left, what happened? You've got somebody to help you. Who would want to do it alone? The same with this picture. You know, Denzel, who wouldn't want Denzel in their life to get to be their coach and to help them? If you're not managing and it's really hard, nobody knows which way to go. Now I'm going to share 2 stories from the field and then I'm going to answer some questions. Hopefully you have lots of questions. Okay, this is Jane. Jane wants to be the poster child for why you need to care about diabetes. Jane was diagnosed with type 1 diabetes at age 14. Okay, she kept telling everybody she was too busy to manage her diabetes. She made it through high school, she made it through college, she got married, she got pregnant. She went to the doctor's office and he said, how long have you not been managing your diabetes? She hadn't been managing it much at all, maybe every once in a while. She ended up having to have both of her legs from her knees down amputated. She had her right arm amputated, and a few years later, she had her left one. This is the worst case scenario, but for type 1 or type 2, if you choose not to manage it, this is what you're risking. Now, who would want to do it? She wants to be the poster child to let everybody know why you need to care. And this is Bob. Bob is one of our truck drivers. But Bob doesn't wear shoes when he drives across the country. Anybody know why he doesn't wear shoes when he drives across the country? And how hard it is to do that in the winter? Bob has no feeling in his feet, okay? The neuropathy has caused such havoc on his body that he always says, I can't wear shoes, I can't feel the pedals. Now, nobody wants anybody driving anything if they can't feel the pedals. We've got one more slide and then we're going to open up to questions and answers. I like to end with this slide because we can all relate to this slide. Dorothy only gets to where Dorothy wants to go with what? Help along the way, right? We all need help. We all need coaches. And what we provide is the data analysis to show you the opportunity to save some money. We also provide the angel on your shoulder to help you, if you have diabetes, manage your diabetes so that you can save your life and your leg and your sight and decrease the medical spend. And now we're going to go to this slide.
Yeah, I was just adding a couple things as she was talking. I have a son that's a type 1 diabetic. He's 20 now, was diagnosed at 7. And then a father that's a type 2 diabetic. And the biggest things I see kind of along what she was saying is with type 2, I know my father was never educated. It was take this metformin, go on your way. There was no food education. There was no, I mean, I would say, Dad, what's your A1C? And he'd be like, what's an A1C? They've been telling him. And for those of you that may not know, an A1C is what's checked every 3 to 6 months when you go in for your visits to tell you where your blood sugars have been over the course of that time frame. And so you want your A1C a type 2, I think they want it probably 6.5 or under, really. And he had no idea what his was. So he didn't even know what he was shooting for or what he should be doing. And that's the really bad misconception with type 2 is take this pill and move on, because then there are those long-term effects. He does have some neuropathy. He has had open heart surgery. He, you know, has vision problems because he's never fully been educated on what to do along the way.
Yeah, and your father's probably what, over 60s?
So yeah, 70.
So that years ago, when he was growing up, it was called the sugar disease. And everybody just thought, well, you had the sugar disease. And there wasn't the education. There was a lot of the pushing of the pills, right? Pharmaceutical companies are making this all worse because they are pushing pills. Like you said, they're pushing, take this pill, take this pill, take this pill. There wasn't the education. There is the education now. And that's why I so greatly appreciate the opportunity to share this, because maybe 1 or 2 of you will share this with other people, or you'll allow me to share it with other people. Because the more we learn and the more we understand, we can help somebody else manage their diabetes.
Kay, outstanding briefing. I've seen something very similar. We are self-funded, and our healthcare captive has done a phenomenal job in trying to educate. My question, and you've seen this already, you've already alluded to it with the pharmaceutical companies, but it's also with the employees and the culture of, well, the insulin is free. Well, and I've already reached my catastrophic or my cap. So now I don't have to worry about any personal costs. How do you think we go about changing this culture of healthcare? I mean, companies have the same challenge with, hey, I'm paying Blue Cross and Blue Shield to provide the healthcare. So that's good. And it's not good. It is education. As your shock and awe briefing, I love it. It's such a great briefing. But how do you think we change this from an my insurance covers it culture to a value-driven personal management of your health? Have you seen something that works? But
you're self-funded?
Yes, we are.
Okay, so let's talk after this, but let me just say something. That's the $1 million question. How do you get people to be responsible for their health? You know, I walked into a gas station the other day after getting gas, and I saw some guy at the counter. He must have been 500 pounds, no, maybe 400 pounds, and he was waddling back and forth, and he had 2 super hot dogs in his hand and 3 great big Kit Kat bars. And it's like, where are you going to end up? How do you get people responsible for their own health? I mean, even at the emergency room, people will run to the emergency room because they figure, I'm not going to pay for it. And if they don't have insurance, I'm not going to pay for it. The only thing you can do, I think, as an employer is create an environment where you support the education of all the different kinds of diseases, for weight management, for blood pressure, for diabetes, and develop a program where from the top down, they really support taking the time to take care of yourself. Because we work so hard sometimes, we don't take time to take care of ourselves. But I'll be happy to talk with you offline, and we could do an analysis for you for free and show you how much you're spending, because I'll promise all of you guys, there is not a plan out there, that not the Blue Cross, not the Aetna, not the Prudential, not any of them, who really wants to reduce your medical claims.
But I love this briefing, and I think it's a super opportunity for us to continue to share this with, number one, our employees, but number two, other employers, on how education will help us change the culture. Thank you.
Couple of things I was going to mention. I know of one company here in town, and they're pretty good size. They're a self-funded group, but what they do is they have certain guidelines, and if you meet these guidelines, and they do their own testing, if you meet these guidelines, you get a reduction in your premiums. And that's, you know, it seems to have worked. That's one thing. But to me, this is such a complicated problem, because correct me if I'm wrong, but a lot of times I see it's lower income where there is more diabetes. And so, and also there are neighborhoods where there are no grocery stores.
Yeah.
People always eat fast food.
Mm-hmm.
And I hate to say this, but my husband and I were in Branson on vacation, and we went to this buffet. I have seen so many overweight people in my life who were at this buffet, and just had, you know, we usually don't go because it's not worth our money. We don't eat enough, or we're careful with what we eat. But that's the only thing. That was just, I was going to say that there is a company that I know of that they do that.
There are a lot of companies in the United States that will reduce your premium if you start to take care of yourself, but 10% of the working population has diabetes. And it's 34 million people right now, but by 2030, it's expected to be 40 million people. And yes, people who don't have education, just like with smoking or wearing seatbelts or any of those kinds of things, may not have the opportunity to get the education. But 10% of the working population, 15% of trucking, 20% of American Indians, and in the South, it's much higher. And Drew, you said insulin is free. Insulin is free for some people. For some of the companies we work with, it's not free. Metformin may be a $5 copay. Metformin's free somewhere. So it's not free all the time, because sometimes we see companies spending $1 million on insulin. Depends who your carrier is. But
the employee is the one who always says that, or it's only $5. I go back to it's just a cultural thing about what the deductibles are and everything else. And you're right. It's perversive. It's a perverse incentive, as you've alluded to.
Yeah, it's education, right? And it's how you educate. You know, it's like people who quit smoking, it takes 5 times before them to remain quit. There's a teachable moment in everybody's life. You know, if you get free medication, you want to pop pills all day, A lot of people will do that, but it's not helping you. So you've got to present it in the right fashion. Sometimes you've got to present it 3 or 4 or 5 times. We have the most success with companies that have a clinic inside, where they go to the clinic and the clinic will say, well, you could call True Life Care, and True Life Care will provide you with all the free testing supplies, free blood pressure cuff, and they'll support you in your journey to manage the disease. It's a hard disease to manage, but if you could get the help, it is manageable.
You talked about this exploding in the last 50 years. How much of that is because of our lifestyle change? You know, there's probably a lot more office jobs and desk jobs and cubicle jobs even than there were 50 years ago. And then how much is because we go out to eat a lot more, you know, I'm sure, than we did 50 years ago.
Well, I think first you guys can all answer that question, because I remember when I grew up in Chicago, I used to walk to school, right? When I was in kindergarten, that was what everybody did. We walked to school. We would walk a mile to school, and then we would come home from school, and what do? You drop off your books, you go eat a cookie, you go outside and you play till 6 o'clock, and then you come in for dinner, right? You didn't see in the 60s and the 70s, I don't think you saw as many kids that were that overweight. What do kids do these days? You know, you get a ride, you're on your computer, you're on your telephone, you're like this all day long. You come home, you lay down in bed, and for 3 hours, you're on your phone, which I have 3 kids too, and I've seen that. Also, if you go to 7-Eleven or any of those fast food gas stations, when I was growing up, Kit Kat bars were about this size, okay? Kit Kat bars are now this size. When you go get an order of French fries, does anybody ever get a French fries that's, everything you eat is supposed to be the size of your fist? Has anybody ever gone to a restaurant where you get something that's the size of your fist? No, if you don't get French fries that are like this, what happens? Where's my French fries? We are a carb-heavy country. Carbs have gotten a lot worse over the last few years. I mean, we eat way too many carbs. There is a keto plan, and I'm sure, Angie, you've heard of this. There is a keto plan where if you lower your carbs, so stop eating so many chips, stop eating so many crackers, stop eating so much rice, so much corn, so many French fries, so many potatoes, reduce your carbs. And that's one of the things the nurses work with people in our program. Reduce your carbs, and you can reduce your sugar levels. I can send this presentation to Randy, because there's a few people that have said they want this. So maybe Randy, if I send it to you, would you mind sending it out to anybody? And if there, and I'm still available to answer questions and answer questions.
Nick, I know you've got a question.
Yeah, I typed it up and sent it, and I was like, whoa, that was a lot of text. So what is the interplay between privacy and discrimination and getting employees the help that they need?
I think it's horrific that somebody has to ration their insulin and decide if their kid's going to get it or if they're going to get it. I know every once in a while you hear a story about somebody who passed away because they couldn't afford their own insulin, which is just terrible. So, it would be nice. I think because you can't change type 1, I think insulin should be free for everybody who has type 1 diabetes, because it's life or death, right? There's so much to discuss about everything that you said, but thank goodness he or she feels comfortable enough sharing that with you. I think that person, they didn't do anything to cause type 1 diabetes. I would encourage that person to go to HR, or maybe you go with that person to HR and you sit down and talk with them, because they can't, if you're rationing your insulin between yourself and your child, you're playing with fire big time.
Yeah, you are.
Big time. And sometimes you can, I've heard that this works before, and Angie may have something to say about it. I've heard sometimes that if you write a letter to the companies that produce insulin, sometimes they'll give you, the insulin. You kind of explain it's either me or my kid who gets the insulin. So I think that there are some resources out there. You just got to search on the internet, or Angie, since you're dealing with type 1, you may know too.
Sorry. You can go to some of the companies direct, and they can give you, even if it's just some coupons or something to help with the cost of, and a lot of the times the doctors, if they are open and honest with their doctors, and it's a good doctor, I guess I should say, they'll help them down that path of maybe finding the coupons or finding some grants that can help them get their supplies. Because they're outrageous, and a lot of the times in a type 1 or situation, insurance does not cover all of it. They can be very burdensome.
Yeah, I was just going to add, there was a book called Body for Life that the author was Bill Phillips. It came out probably 20 years ago, maybe longer, but it's that's one of the things that stuck with me out of that book. My wife and I did it. And we've kind of been living that our lifestyle since then. But the whole thing of, the food portion size is the size of your fist. It goes a long ways in controlling how much you eat. If the bigger person's going to have a bigger hand, so you can maybe eat a little bit more, and the smaller person's going to have a smaller hand, so they eat less. And it just is a real simple way to control how much you're eating.
Was this helpful? Was this helpful?
I was fascinated by it, Kay. It's a big reminder. And when you talk about that we go out to eat, I always get more than I can eat at any restaurant. It doesn't matter what you order. They bring you more than I really want. I don't know why that is, but
well, I think, go ahead.
I'd just like to be able to order less, but you can't.
Well, I think the only good thing that's come out of the coronavirus, if there's any good thing, is I don't think we're going to have buffets as we used to have buffets anymore. At least all the ones around here, they don't have buffets anymore. Even the grocery store doesn't have the salad bar anymore. So those great big buffets for $8.99 where you can eat all you can eat, and people are there 100 times. But again, I can send the presentation to Randy. Randy can send it to all of you. If there's any information in the presentation and you want to copy and paste and you think it'll be useful for your own information or your own presentation, please feel free to do that. And my contact information, you all have my LinkedIn profile, so you all can connect with me. If you know anybody who you think would also benefit from this presentation, I'm more than happy to provide the presentation anytime. It really only takes about a half an hour, and then Q&As for 15 minutes. And if you have data and you want us to review the data for free, we're more than happy to provide you with an analysis too for self-funded groups.
Well, that's awesome. Well, thanks a lot, Kay. It's great information. Really appreciate it.
I hope your son's doing well, Angie. Sure.
Next week, we're back on Thursday again, since the holiday is on the weekend. And Chase Kaufman, that a lot of you know, we're going to talk about his journey and lessons he's learned from sports and perseverance and how he's translated that to the business world. So he's a wonderful, young leader, up and comer that's just a great person and has, I think, have really good lessons from life that he's brought in. So I'll get that out to all of you and see you next Thursday. Have a great weekend.
All right,
Thanks,
thanks everybody.